华生陪你谈笑风生。
大家好，华生陪你谈笑风生。我们今天有个特别的节目。So today we are focusing on children and young people's mental health and well-being, drawing on the evidence from the joint statement developed by the Public Health Wales and national experts. The statement shows a clear rise in emotional difficulties such as anxiety and depression emerging earlier in childhood and often continuing into young adulthood. So it also highlights widening inequalities, the impact of school pressure, poverty, digital life, and the vital role families play in supporting well-being. In this episode, we'll hear from healthcare professionals to help us understand what this evidence means in real life for parents, carers, and young people listening at home. So we explore what families can look out for, how support should work, and what helps children and young people feel safe, supported, and able to thrive. So let's welcome Amy Davis from Principal Public Health Practitioner, Public Health Wales, and my colleague Joanne, who is in charge of the Mental Wellbeing Project of Chinese and Wales Association. Welcome both.
Thank you.
Right. All right. Yes. So it's interesting. So let's talk about the joint statement that we read recently. So it shows a clear rise in mental health difficulties among children and young people over the past 20 years. So Amy, from your professional perspective, what does this data tell us about what families are facing today?
Interesting question, and thank you for inviting me to be on your podcast today. So more families are supporting their children with feelings of distress, particularly signs and symptoms of emotional difficulties, things like anxiety and depression. More families are experiencing concerns about body image, eating disorders, self-harm. And these increases are real. They're seen across all genders, but the greatest need is seen among females and those who identify as neither a boy nor a girl. And it's worth just starting off by kind of setting the scene that mental health and mental well-being are distinct but related concepts that often interact. So people can experience poor mental well-being whilst not having a mental health condition. And conversely, people can live with a mental health condition and still experience periods of good mental well-being. But what we're seeing in the data is that the proportion of young people who are reporting low mental well-being is increasing. And so families are then facing this kind of decline in well-being and rise in mental health difficulty. So how this might show up for families, it might look like a lack of enjoyment in life, difficulty concentrating, feelings worried, decreased energy, changes to sleep patterns. You might notice differences in ability to socialize and difficulty coping with situations and periods of stress. And the data, what we're seeing does paint quite a sad and difficult picture. But I do want to emphasize for us all that there is hope. So we've seen historical periods of improvement in the long-term trends. So that indicates that it is possible to turn things around for our population. And I think we're in a period now where we've got many partners coming together across disciplines, different sectors, really wanting to galvanise efforts to improve this picture for children, young people and families.
Well, the second question by Joanne.
So we would love to ask, emotional difficulties are emerging earlier and persisting into adulthood. How should this evidence shape the way health professions talk to parents about early signs and early support?
Thank you. Yeah. You're right that we've got studies in the UK that are showing those emotional difficulties emerging earlier and persisting for young people. So that shows that that's much more likely for people who were born at the turn of the century compared to people who were born in, say, the early 90s. When we look at that kind of estimated prevalence of mental health disorders, we can do some estimates for our very young age group, so 1 to 7-year-olds. And in Wales, we think that it's around just over 45,000 1 to 7-year-olds experiencing a mental health disorder. It's around, over 135,000 children and young people aged 8 to 24 are estimated to have a diagnosable mental health difficulty. And when we look at the breakdown in ages, that equates to about 1 in 6, 8 to 10-year-olds, 1 in 5, 11 to 16-year-olds, and 1 in 4, 17 to 24-year-olds. So we can see that these difficulties appear across the life course, but even from very, very young ages. And that kind of early support really speaks to everything we know about good mental health and well-being being essential for that overall health and development and prospects for children. We know that giving every child the best very early start in life can be one of the most important factors in helping them thrive today and have those strong, resilient futures for tomorrow. So it's really essential that even from the earliest days, parents and families are supported to look after their own mental well-being and to create those kinds of environments where children are protected from harm, can build supportive relationships, develop healthy lifestyles and habits, get good quality sleep, and have engagement with activities that are really meaningful to them.
So that's really helpful. It's less about labeling and more about noticing patterns early and responding supportively.
I am a parent with young children. We also quite worry about this because when we know that it's getting earlier than earlier to develop these symptoms. So sometimes when a little thing happened to our children, we feel like, oh, is it mental health? Or is he suffering from mental health? So it makes us very restless sometimes to see our children become like outbursts with emotion. So we thought, is it mental health? Is it mental health issues? How do we need to address? So it's really not easy. Yeah. Right. So go back to the questions. So the statement highlights widening inequalities, particularly linked to poverty and disadvantage. How do these inequalities show up in clinical practice, and what should families understand about their impact on mental health?
Yeah, that's a really important factor to think about. So I'm not a clinician, so I can speak less about how things show up in a kind of clinical sense. But the data and evidence is really clear that we've got established patterns where certain groups of children and young people are disproportionately affected by mental health difficulties. And broadly speaking, that's true for groups that experience life stresses. So they can be things like poverty, bullying or maltreatment, racism or discrimination, groups that are neurodivergent, care experienced, or have a parent with mental health problems are all at greater risk of experiencing difficulties themselves. And the most recent data that we've been exploring through this joint statement has shown that the inequalities in mental health outcomes are deepening, and with a larger growth in difficulties among children from less affluent backgrounds. So the fact of poverty is a real, really present, really front and centre in what we're looking at. And the picture in Wales shows that about 29% of children and young people in Wales live in relative income poverty. And those from the poorest 20% of households are 4 times more likely to experience mental health problems than those in the most affluent 20% of households. So there's a real impact there. I think some of the underlying factors of that are an increase in stress within a household that's experiencing poverty, impact on family relationships. Children and young people can experience shame, stigma, bullying as a result of that. And I think those are common threads that are true for any group of young people who are experiencing bullying or maltreatment or discrimination in any way because of any factor. The income issue also means they might be less likely to have access to healthy foods or social activities that are supportive of mental well-being. So there's a lot of dynamic factors in the picture. I think at a Wales level, we've got the child poverty strategy, which is kind of outlining those national approaches to reducing costs, maximising incomes, creating those kind of pathways for people to support. But I think there's something important about the real emphasis that we need to have as communities on kind of coordinated action. So that touches things like housing security, living conditions, fair work opportunities, but also kind of inclusive and kind communities, volunteering opportunities, activities, all of the things that are able to really positively influence people's lives in the round, if that makes sense.
Yes, sounds like inequality makes very significant relationship between poor mental health conditions and the young generations who suffered in a poor family. So the next question to ask is parental mental health is identified as a key contributing factor to children's mental well-being. How can healthcare professions support the whole family, not just the child or young person presenting in services?
Yeah, thank you. Yeah, that's true. In Wales, we had a study that looked at children born between 1987 and 2018. And from that, we saw that about 35% of mothers and 18% of fathers or father figures had a diagnosis of depression in that period. For children who were receiving care and support in Wales, parental mental ill health is recorded as a factor in about 42% of cases. So, this is a real rising and recorded phenomena that we're looking at. The mental health of parents and children exists in a kind of dynamic and reciprocal relationship. They affect one another, and addressing and protecting parents' mental health does reduce that risk of passing on intergenerational trauma, of passing on those experiences of emotional challenge. The parents have an absolutely fundamental role in shaping the emotional development of their children, and just fundamentally parents with good mental health are better able to support emotional expression, manage that range of emotions. These are normal. It's normal to feel the full range of emotions, but how we kind of respond and manage stress around that is really shaped by how we do that as a family. So yeah, I think kind of all of that points to the importance of protecting parental mental health as a kind of an essential part of that jigsaw. I think the kinds of things that can mean or look like are things like strengthening that early support for mothers and fathers and caregivers from that kind of perinatal period, but also through to if children and young people are accessing support for their own mental health difficulties later on in life, to kind of have that as a family consideration rather than just the individual. And I think there's something important about expanding access to the kind of community-based services that support early intervention approaches and offer opportunities that help children's development and well-being, as well as parents' mental well-being, kind of together in communities. They feel like really important factors to help support parents in the long term.
Yeah, it sounds like supporting a child really means supporting the whole system around them. And we as Chinese in Wales Association, we provide a lot of early intervention well-being support for families.
Yes, we have done a few episodes talking about this. And then we have a Chinese counselor. So we talk about parenting, and then we talk about communication, and we talk about mental health. And then we all agreed if parents have mental health well-being, very naturally, the children will be well supported. So the counselor said, so normally we don't need to fix the children. All we need to fix is parents. Oh, yeah, not stereotype, but yeah, but what it's trying to say is if as parents we know very well if we are in the good state of mind, so sometimes we know how to handle the situation better, at home. Yeah, so definitely our mental health well-being is absolutely important, not to affect our children. So now we talk about young people involved in this evidence, stressed the importance of supporting the supporters. Like, what does good support for parents and carers actually look like in health and in community settings?
Yeah, that's right. The young people that we talked to shared that circle of supporters, and by that they were meaning or including parents, carers, but people like teachers, youth workers, social workers, mental health professionals they'd seen, kind of community leaders. It can be a kind of wide range of people that they're talking about, but they were reflected how important they were to building a kind of effective and sustainable support network for their mental health and well-being longer term. And what they were really talking about is that, if those supporting adults around them, whoever they were in that kind of broad network, felt overwhelmed or unsupported themselves, their experience was that they could then struggle to provide a kind of really present and consistent support for the young people. So that was, why that was felt as a really important ingredient. Some of the things that we talked about that could make for kind of good support for those supporters were things like helping communities to understand, increase their understanding of trauma and how to break cycles of violence and adversity and experiences of trauma. And other things they talked about were, as we've mentioned before, kind of supporting those adults to take action to protect and improve their own mental well-being. Working with partners in local communities to increase access to the kinds of activities that will help those adults as well as the wider community and the young people. And often those were things that centered around engagement with arts, culture, connected with nature. So kind of simple things like that were felt to be really important for supporting the whole network of people, professionally and in communities.
Yeah, I do believe breaking isolations, and that would enhance well-being in our community, and like gaining more knowledge that would help our community to break isolations and enhance well-being. So the next question would be, school pressure is highlighted as a significant driver of emotional difficulties. How can health professions help families navigate conversation with schools when mental health concerns arise?
Thank you. Yeah, schools are a really important setting in children and young people's lives. They spend an awful lot of time there, and they can have an enormous influence. In Wales, we have something called the whole school approach to emotional and mental well-being. So this is a statutory framework. It applies to all education settings, and it means that all schools should be actively engaging directly with families and learners about mental health and well-being. So if the experience of families is that they're not, they can use that framework as a way into approaching schools to open up conversations around some of those issues. That framework that all schools should be working to does require the school as a setting to self-evaluate their needs and strengths and to put in place an action plan as part of a kind of continuous improvement cycle that's about supporting the emotional and mental well-being of all learners and also the school staff as a workforce supporting them. And some of the areas of focus that they hone in on in that framework are about understanding and meeting needs of the population in the school. There's also a really strong emphasis on developing positive relationships and feelings of belonging, there's a strong emphasis on ensuring a really timely access to help and support. And we've got some resources online that we can share with listeners that can help families to learn more about that approach and could help open up conversations with the school if they were feeling that would be helpful. We've also got worth mentioning that there are a programme of work called Child and Adolescent Mental Health Service InReach teams. So there's 7 of those in Wales, 1 in each health board. And they've been supported to really come alongside schools and kind of offer enhanced training and advice and consultation and be a better bridge between the the more specialist mental health services that some children might need to be referred into, and kind of schools and families. So I think there are some mechanisms in place that are really helpful and are really trying to improve that, and they can be helpful ways in for families if they want to raise something with the school or have some conversations about kind of further advice and support with them.
My children, sometimes I ask them, do you use that service in school when you don't feel good? I think they themselves also aware. No, they're only in their early teen. They also feel that no, going to that means I have something wrong with me. I say, oh guys, sometimes I encourage my children, if you feel really emotional, or if you feel really challenging, if you have challenging moment in school, you can just tell your teacher, and then you want to you need support. And they said no. I said, why? They say no. So then no, talk further down to that. Like the stigma attached, that even children understand, if I go for that support, that means there's something wrong with me. So no, it's just that we all need that support sometimes. Even I myself, I need to talk to someone in order to release some kind of a satisfactory feelings to something or someone. Yeah, we need someone to talk to. But I know.
Still some work to do to break down that kind of feeling, and there's nothing wrong. That's not what's going on there. It's just
Okay, now next question. So the digital technology and the social media are described as both a risk and a benefit. So what balance or evidence-based advice can clinicians offer families without placing blame on parents or young people?
Yeah, this is a really complex area and a really interesting one. And you're right, technological developments and social media do provide both benefits and challenges for mental health. And the evidence is still very much emerging about what types of use might be more or less harmful. Or what we do know is that how young people engage with something like social media appears to be important. So one of the recent studies found that young people who were frequently sharing content and messaging were more likely to experience negative impacts on their mental health than, say, children who were using that media in a different way. And, broadly speaking, the research evidence is highlighting the importance of moderating the use of social media and things like streaming platforms. We do monitor across the population like what might be happening around problematic social media use. So data from a couple of years ago suggests that about 1 in 10 boys were classed as having a problematic social media use throughout secondary school. That was fairly stable. Whereas what we see in the rates among girls is a real sharp rise with age. So about 12% of year 7 girls were classed as problematic social media users. That increased to 21% by year 10, with a really notable rise between year 7 and 8. So there's something about the way that digital technology and social media is experienced differently for different young people. And I just don't think we know enough about the evidence about what is really going on there yet. I think it's just what we do know. Again, I think, it's important to promote the benefits that we do see to kind of online connectivity and digital inclusion, and balancing that with adapting to digital risks like harmful content or excessive screen time or the bullying that can happen in those online spaces. So I think, in short, it's not easy. We've still got a lot to find out and learn. There are some helpful tools. Something called digital resilience is quite helpful, and that's available via the Hub platform. So all children in school can access that, and their parents. And again, I can share a link. And that's got some lots of support for children, families and schools about kind of navigating the online world, support around things like cyber hygiene, dealing with misinformation, digital safeguarding. And I think generally just kind of being, as a family, being more informed can help you make those personal choices about what's best for your family. To sum up, over recent years, that demand for mental health support has outpaced capacity of services, and that's created a widening gap between the people who need help and how they can access kind of timely, appropriate support. And in order to meet that growing need, we do need a response across all sectors, one that starts in the early years, one that prioritises prevention, equity and early intervention, and one that's really co-produced by listening to children, young people, their families and their communities. The mental health and wellbeing strategy, which I haven't mentioned much yet, but that's really important in the current context. That's set out a vision for the next 10 years, which is really transformative. It's really ambitious. It wants us to have the building blocks in place across the country to support good mental health and well-being. It wants everyone to have the knowledge, opportunities and confidence to protect their own mental well-being. It wants a connected system where people can receive the appropriate support whenever they reach out, and for that to be really seamless, person-centred and just kind of needs-led by the individuals. And I think sort of one of the key messages is that everyone can get involved in making those visions a reality. And that could be through things like sharing experiences of your own mental health difficulties and positive experiences, sharing what matters to you, volunteering in your community, increasing your knowledge on mental well-being and what works to protect it, and sharing that with others. And I think engaging with something like our Happers programme, where we're promoting wellbeing experiences across kind of 8 themes that involve connecting with others, looking after our physical health, connecting with history, heritage, being creative, and many more, can really help to kind of raise the awareness, understanding and sharing of that positive message, and improve things for families and everyone in them.
Great. So that leads to the next question. What is one practical thing families can do to seek help early?
So I think it's really important that if children and young people need to feel like they can talk to a trusted adult if they're experiencing any difficulty, and that should be taken seriously. There are a couple of really key routes for help and support that help with that really early access. So if you need to talk to someone about your mental health or you're concerned about a family member, there's a service where you dial 111 and press the number 2 option, and that gives urgent access to a mental health professional. It's available for people of all ages, 24 hours a day, 7 days a week. There's also something called the Call Helpline, again, open 24/7, and that offers kind of confidential emotional support and advice either to individuals or members of their family. So we can again share that number. For children and young people, there's a service called Mike, which offers again a helpline designed and dedicated to supporting children and young people. And I believe that the resources and information that you provide as the Chinese in Wales Association are a great starting point for people who want to seek help early and connect in with something that's going to help them. we individually are interested in, what we enjoy. Making time for those activities that are meaningful for us and allowing them to take our full attention offers our minds that opportunity to refuel. And habits is all about making us feel that know and accept that that's not selfish, it's not a nice to have, but is the essential underpinning for the rest of our physical and mental health. So there are kind of common themes that we promote through habits, and I'd encourage families to explore those ideas and tools and find something that might work for them to take that inspiration from.
Thank you.
Brilliant. Thank you very much.